Big voices and big names are bringing awareness to what was once a quieter conversation. Oprah is just one of the many celebrities who have chosen to address the reality that is menopause. It's something most women experience. And so today, our goal is to add to the conversation in a way that is helpful to you. My next guest is an OB-GYN, and she'll tell us all we need to know about menopause, including symptoms to expect and medications to take. Dr. Margit Lister joins me, and it's something we're all it's the buzz among all of my friends right now, talking about who's in it, who's almost there, what's going on. But kind of just start us off with the basics of what is menopause.
I think the easiest way to explain menopause is actually defined as the cease of menstruation or no menstrual cycles for 12 months. So everybody is thinking that, oh, if I don't have a period or I skip my period, maybe I'm in menopause, but it's actually that 12-month kind of cessation that defines it.
It has to be a whole 12 months, okay.
A whole year.
And is there kind of a general age when this will happen for women?
Yeah, the average age of menopause is about 51.4 is what they statistically say. What I usually tell my patients is about 80% of people will go through this by the age of 53.
Okay, good to know. Whew. We're getting close. Okay, so besides that cessation of menstruation, what else could we expect?
It's got a multitude of different changes. It becomes the new you. So some of the simple things or common things that people experience are hot flashes. If they happen at night, their night sweats. Sexual function may change. You may notice some vaginal dryness and difficulty with intercourse. Some other things that aren't as talked about is joint pain, headaches, mood changes, sleep disturbances, like all of those things. There's a lot of different kind of subtle changes where you're like, I don't remember this. And a lot of those can be attributed during that transition.
Yeah, it seems like it just runs the gamut. Like you can have so many different symptoms. So as a medical professional, you have 5 things you want women to know about menopause. And the first one, that checking your hormones will not tell you if you're in menopause. That may come as a surprise to a lot of people.
Yeah, I think so. It does to my patients. And what I would say is we've already defined what menopause is. It's no menstrual cycle for 1 year. So you can actually have your menstrual cycle and then a couple weeks later get your hormones checked. And it may show that you're menopausal because you go through, what I always tell my patients is your ovaries kind of just get tired and they stop ovulating. And so your hormones start to drop, you have hot flashes and night sweats, and then a couple months go by and your ovaries go, wait, I have some more eggs. And so you may menstruate again for a few months, and then the hot flashes and night sweats all go away, and you think, gosh, I feel
false
safe.
alarm.
Yeah, I feel fine. And then, but that cycle happens for about 4 to 7 years, depending on the person.
Wow. Okay.
And so it's not until that final menstrual cycle after 12 months that you can say, okay, I'm actually here. I've arrived.
We have to be patient, it sounds like. Okay, the next one is something I hadn't heard of, WHI. Misinformation here. What is the WHI?
The Women's Health Initiative.
Okay.
This is the kind of landmark study that happened in 2003 that kind of changed everyone's perception about hormone replacement therapy. And it was misconstrued. The Women's Health Initiative was developed to help women understand if hormone replacement therapy prevents heart disease. And the answer is it doesn't.
Okay.
It didn't answer the question, and it was kind of construed that hormone replacement therapy is bad. And actually, hormone replacement therapy is really a great option for women in their 40s and 50s. The Women's Health Initiative only looked at women 50 to 80. And so a lot of the extrapolation of the information that came out with the Women's Health Initiative was kind of extrapolated into the age group that wasn't even in that study.
Yeah, and that was kind of your next point, that hormone replacement therapy is safe.
It is a safe option for most 40 to 50-year-olds.
Okay, good. Okay, so next you say we don't need to go to a compounding pharmacy to get bioidentical hormones.
Correct.
Okay, explain that.
So the FDA has approved several bioidentical hormones, and you can go to your physician and get those compounds that are bioidentical, meaning they're exactly the same as the estrogen and progesterone that your body produces. People think that if you go to a compounding pharmacy, that's the only place that you can get bioidentical hormones, and that's not correct. Those compounding pharmacies have discrepancies sometimes in the dose that is actually in what you're getting, and so that's what makes the bioidentical hormones that your physician provides a little bit safer, because you always know that is FDA approved and monitored, so that you get that medication at that dose.
Okay, so for people who are around my age, entering their 50s, do you just suggest kind of that yearly checkup to know that if you're getting close or if you're not, or is there something we should be doing to even kind of get prepared for this?
My best option is, or my best recommendation would be to just don't be afraid.
Okay.
Like, this is a transition. This is what all women go through. We're all going through it together. And that same transition that happened when you were 10, 12, 14, that was scary, and everybody went through it, and we all survived, and it was actually our new normal. And so menopause will be that too. Like, we don't have to worry about menstrual cycles. We don't have to worry about pregnancy.
Yeah.
So there are some really beautiful things that happen with menopause. It's a change. There's no question.
Yeah.
But it doesn't
don't
have
be
to be
afraid. And because you said attitude can really make a difference.
Attitude can be a huge difference. This is a natural, beautiful process that all women go through, and we need to embrace it and make some time for us, since this is kind of the stage in our life where that becomes a possibility.
Okay, I won't be afraid. Thank you, Dr. Lister. I appreciate your info on this. Thank you.
You're welcome.